So, foot problems. I just got back from my annual training with my guard unit at Fort Bragg, and foot complaints were one of the main things that came into the sick call tent. I think that this has some military implications, but it also definitely has implications for those of you who like to hike, camp, if you consider yourself in the prepper crowd. This is the kind of thing that you need to be able to happen. An army fights on its feet. You can't function if you can't walk around real well. So let's talk about ways to make sure that you stay healthier in terms of your feet. First is just the general muscle aches of feet and how it hurts to use them sometimes, okay? So there's a couple things that I really think are important for this. One is break your shoes in. Brand new shiny boots out of the box just flat out are not as comfortable as ones that you've spent some time in and walked around on. I wouldn't start with a Appalachian through hike on brand new shoes, right? You might want to start wearing them around the office a couple days and then get into like some short hikes around your neighborhood before you really get out and test them in nature where they're your main boots for a 2-week adventure, right? You want to make sure those shoes are broken in. The other thing is to make sure your shoes are of reasonable quality, okay? You do not need the Cadillac of shoes. You do not have to have $1,000 hiking boots. So this here is the general issue shoe that is in huge supply at every Army surplus store because they get traded in all the time. I bought these for like $20 used at a surplus store outside of Bragg. This is what I wore for my first couple years in the Guard, and they were horrible. My feet hurt all the time. I had huge blisters when I went to Bolek. I really actively hate these things, but I was too cheap, and I was proudly too cheap. I told myself, I'm not spending money. I don't need to. I'm tough. I can get by. This was horrible. When I got told I was going to be on flight duty and I had to get flight-rated shoes, you just can't get those that cheap, right? So I bought these. These happen to be Rockies. I'm not endorsed by Rocky. I've heard great things, not fire-rated, but I've heard great things about like the Nike boots as well as even the GoRuck folks who I love. They have some good shoes I've heard good things about. But these were like $200. But, oh my gosh, were they so much more comfortable? And I immediately said, how did I suffer through these horrible boots for years when I could have had this wonderful thing that doesn't hurt my feet and is as comfortable to me as a tennis shoe? Sometimes you get what you pay for. And so I do think it's worth finding a boot that you actually find comfortable. They do not have to be miserable. Don't be so proudly cheap that you hurt yourself and suffer. It's not worth it. So let's talk about the next thing. That's general muscle ache stuff, right? Have reasonable shoes, break them in, and get used to walking around for longer periods of time if you're a more sedentary person. The next thing we're going to talk about is blisters, okay? Blisters happen when layers of skin slide against each other and you get a separation between the layers of skin. So if this is the outside layer of your skin, inside layer of your skin, as your foot slides against your boot, it catches on the outside and the inside keeps moving because your foot's going, and you get this separation and then fluid pops up between those two layers. That's a blister, right? That's your skin is separated. And there are ways to avoid that. Multiple things you can try, okay? One is just have reasonable fitting boots. I think that's a good thing, and get used to walking in them. The other thing that is important is play with your sock and boot combination. Find the boots that work. Some folks find a thicker sock helps. I hate thin cotton socks. I find my feet get wet and they're thin. I find that I end up with more trouble with them. So I actually invest in some thicker wool socks, some higher quality socks, and I like that a lot. Some folks like to do the sock liner. They'll do a really thin, almost kind of dress sock, but you want to get a good, not cotton, but get that like a performance material that wicks away pretty well. So you can get sock liners, like thin inner socks, and then you wear the actual hiking boot sock on the outside, and that gives room for the two socks to slide against each other as opposed to your actual 2 layers of skin and creating blisters. The other thing to talk about is, well, what happens when you get blisters? People love to pop blisters. I don't understand it. I like to leave blisters alone. It is not necessarily a great idea to go popping blisters. You do not need to pop them. The only real time to pop a blister is if it hurts too much for you to function. So if it's there, if you notice it, whatever, that's not a reason to go popping these things, because an unpopped blister is not going to get infected. It is completely sterile inside because the outer layer of skin is still intact. You go popping it, you are now exposing that inner, more permeable, more weak layer of skin inside to all of the junk that is out there in the world. And think about all the junk your feet are in, the nastiness in your boots. You don't want to expose that. So you want to try to avoid that if you can, particularly if you're doing dirty work, you're stepping through swamp water or something like that. So how do you pop a blister if it hurts so bad that you just can't possibly not pop it? How do you do it? You're not looking to create a pressure, so don't squeeze on it till it pops. You're not looking to cut a line down the middle because you don't want it to be de-roofed or like the whole top layer to come off any more than necessary. And really, one of the problems, the best way that the podiatry people actually recommend, I'll put a link down below, is to literally just pinhole. If this is the blister right here, you're just going to put some pinholes, sterile as you can, right? Put a couple pinholes all around the outside. That will allow that fluid to leak in multiple places. It tends to heal up pretty quick and will reaccumulate fluid. So if it starts to hurt again, just go through pinhole again around the outside and do your best to not be peeling off that whole top. That's the best thing that you can do for blister care. Some folks find either after a blister or maybe even in some blister prevention, they want to use some tape around their foot, and that gives another firm layer around your foot where the tape will slide against your shoe or against the sock and maybe not give as much of an opportunity for the two layers of skin to slide against each other. So that is my advice for blister care. If you've got some questions or some tips that I'm missing, go ahead and share them down below so that other people can benefit. The next thing I want to talk about is athlete's foot. One of the best things for athlete's foot is to just try and keep your foot as dry as possible. I love dry foot time. Whenever you have the chance, whether you're hiking with friends, you're out camping on your own, or if you're on AT and FTX, you're deployed. If you got some time to take your shoes and socks off and be barefoot and let your feet air out, take that time and use it. The other thing is to just not get fungus on your feet to begin with. Athlete's foot is a fungus after all. One of the best ways to do that is shower shoes. If you are sharing showers with a bunch of people, you should assume some of them have fungus on their feet, right? You are not tough by walking in without shower shoes. Just put the shower shoes on and try to protect your feet. Group showers are gross. They just are. That's not a medical opinion. That's just my opinion. They're gross. And there's fungus in there, and you don't want to be exposing your feet to all of that more than you really have to. So please consider wearing shower shoes, and I sincerely believe your feet will be healthier for it. Any over-the-counter foot fungus, athlete's foot medication tends to work. It comes in sprays. It comes in creams. If you've got room in your pack, it's not a bad idea to maybe have some of that on your own. Maybe your medics have it. They should probably in their big bags, or at least at the battalion aid station. But I think foot fungus cream is a decent idea, but the best way to deal with athlete's foot is to not get athlete's foot. So hopefully that helps you with some of the general foot stuff, blisters, athlete's foot, and then just the general muscle and bone achiness, because it's important that your feet work so that you can function. Leave some questions below if you have any.